Today, we are privileged to have an eminent expert with us to share his invaluable insights on formulating strong research hypotheses for successful grant applications in trauma research. His expertise and experience in global surgery and trauma care make him the perfect guide for this session. Before we begin, I will invite Dr. Deepak Aggarwal for his opening remarks.
Good morning, good afternoon to all of you. Without much ado, we want to start because we already slightly late. The genesis, Dr. Raghu has been with us uh, for decades, I think, and we had a collaboration with him. In fact, myself and Dr. Amit were the first two fellows who moved from here, from Trauma Center to Michigan, to see the trauma systems out there. And after that, many more people have gone, including Bhavita and Manish Singhal also went there, and Kapil. So we had a lot of fellows going in and a very robust collaboration, which culminated into a lot of grants. I was given as a PI RO3 grant, which is a significant grant from NIH, just based on the collaboration. And I think a lot of other people also got grants. So it has been a wonderful, I would say, collaboration, and which has now culminated into having a Dr. Raghavendran come here for annual visits, keep training us so that we keep aspiring for better. So thank you again for being here. I hand over the mic to Rajesh.
To commence the proceedings, I invite our distinguished dignitaries to take the seat at the dais. Dr. M.C. Mishra, so please let the Dr. Kamran Farooq and Dr. Bhavita Gupta. Ma'am, may you please? Um, I would like to invite Dr. Kamran, Chief of Trauma Center, and Professor Orthopedist to please address there.
Thank you. So welcome to all of you and welcome Dr. Raghavendra. And like Deepak has already said, our association with you is such a long lasting. I remember the first time, I think somewhere around 2005 or six when we had the first SCEUTH conference. At that time you had come and then we have had a long collaboration. So it's indeed always a pleasure to have you here and I hope it's the same for you as well. And we are all like, inspired and enlightened by your wide knowledge as well as your experience in trauma research as well as trauma, and we'll always inspire and aspire that you keep guiding us and be a guiding force and mentorship from your university as well. And we hope that we'll be able to continue this sort of collaboration, whatever is possible, despite, like you said, uh, a new leadership in US. But we do hope that we'll find somewhere out. So thank you very much for coming over and accepting the invitation on behalf of Trauma Center as well as Dr. Deepak Aggarwal. And thanks so much.
Thank you, sir. Um, Now may I invite Dr. M.C. Mishra to address the gathering. It's an honor to introduce Professor M.C. Mishra, a renowned surgeon, educator, and missionary leader in trauma care, formerly the director of AIMS, Chief of Trauma Center, and he also served as the HOD of the General Surgery Department. Professor Mishra is widely recognized not only for his expertise in laparoscopic and general surgery, but also his unwavering commitment to teaching, research, and innovation. Foreseeing the urgent need for specialized trauma care in India, he played a key role in establishing the Apex Trauma Care Center at AIMS, which has since become a premier center for trauma care's research and care. His contributions to the field continue to shape the future of surgery and trauma care. We are privileged to have him with us today. Please join me in welcoming Dr. Mishra to the diet.
Thank you very much. Valencia, thank you very much for your kind introduction. What I would say, Kamran, the Chief of Trauma Center, my all friends, faculty, At Trauma Center, I can see Deepak, of course, obviously there, Sanjeev, Kapil, Keshav, Dr. Sushma, Vijay, Amit, and Narendra, and Spinav, and new faculty, Dr. Chavi. We are missing Dr. Babita. She might be busy somewhere. So, and all those who are present here who may not have worked with me or during my tenure here, but it's a proud privilege to be here anytime. And thank you, Deepak, for giving me this opportunity. Dr. Rajpal, Professor of Ophthalmology, who is a dear friend for a long time. It is indeed, it was an accidental meeting with Raghu, sort of a. It was, I think, somewhere in 2009, November, December, when Dr. Ramam, who is a Jipmer alumni and Dr. Raghu's friend, so he crossed in Wales, and he said, sir, who does trauma at KIMS? So I said, you can tell me what is to be done. So then he said, no, this is what Dr. Raghavendran and Krishnan, who is in Michigan, and he wants to touch base with someone who is involved in this. Trauma Center had just begun in 2006. And I think very early on, 2007 or 8, a team of Shock Trauma Center also visited us when we were just starting this. So Raghu was very kind. I was going to Calgary. I think some of you might have met Dr. John Kortwig. He came for our inaugural ATLS course in April 2009. So he invited me to Calgary for a keynote address. And that's how, and from there, Raghu then paid for my ticket to visit from Calgary to Michigan. He hosted me. Thank you so much. The memories are still very fresh. And I delivered a talk on trauma there as well at Michigan. So that's you can say now, 2010, and now we are in 2025. A lot of things have happened in between, and एक चीज जो मैं आप सबको बताना चाहता हूं कि हम भारतीयों में, जब हम हिंदुस्तान में हमारा जन्म होता है, ये हमारी मातृभूमि है, कुछ वर्षों तक ये कर्म भूमि भी रहती है, लेकिन फिर भी अगर हम लोग कहीं बाहर चले जाते हैं, और वही रघु के साथ भी है, आप इंडिया छोड़ सकते हैं बट इंडिया को नहीं छोड़ सकते. So give a big round of applause to Raghu. That he wants to do whatever he can in his capacity to nurture, to develop research environment which is not so rich in Indian institutions. You almost have realized this. AIMS is different, Trauma Center is different, but if you go across in private, there is no research talk, no academics. So I think all of you are very privileged who are spending time here and contribute here as long as it takes. Money will come in life. So don't worry about money, how much money we need for living. So this is something which I think all of you must realize, that he is traveling all the way from there and devoting his precious time, money and everything to encourage us, to also some way enlighten us on certain aspects of research, because research is one area which I have always felt is deficient with all of us. We don't think in that their mindset in a daily life, that every patient who walks into the hospital falls into some protocol or the other. Whatever we do must, and not necessarily we adopt things from US or Europe. I think we have to develop our own protocols, but that should be on sound basis. That should be on sound data, what we generate here, very huge data. And that has been the deficiency. Despite that we have large number of patients, still we don't figure in guidelines anywhere. So I think that is where we have to work, even in trauma. And that is something, and this trauma center is privileged. Now there is a project which is ongoing. Amit and his team is leading that. They are doing capacity building in various institutions by organizing quality improvement programs in trauma. I think that is one aspect, but I think still there is a lot needs to be done, which is remaining. And I thank again Raghu for coming and spending his time here. Sanjeev has done wonderful work. Deepak has been a real point for this trauma center who has multidimensional interests. And I think it's a pity if we cannot utilize the strength of our faculty. That is a pity of All India Institute at the level of the leadership. If they cannot see who is doing what and they take things as routine, I think that is unfortunate, but let's hope that things will change in coming times and all of you have to change. I think all of you have changed the scenario. If you look back, I shared some videos with Amit, Dr. Sushma recently, Sumit, the kind of operations, it's now you cannot think, oh, we did this, how did we this, how the patients were salvaged. So this trauma center did that. And it's a wonderful opportunity. And I can tell you, I've worked now in private for almost 7 years, 8 years. There's nothing, no place like this, even today, no academic institution, no private institution. Okay, we give quality care outside, but that's care only. That is all. We see one patient at a time and that's it. So I think that is the privilege all of you have got. So use time here more productively in terms of academics and research. When you go out, then you will realize what you are missing. Till you are here, you don't realize what you have. Your residents, your nurses are the backbone. And this luxury, you don't get it privately. I do now fully without any assistance. You know in private, so you can imagine, because they see everything in money terms. How much money they are spending on whom and why. So it's a privilege to work here, and I wish all of you that you bring this institution to newer heights, and under the leadership of Dr. Kamra, I'm sure. I think we can say that in spine itself, we can say that where you need to operate, where you don't need to operate. I think that's the kind of work we need to do. And also in many other aspects, and how many patients you could salvage limbs which were almost given up. I think this center has done that to a large extent. So thank you so much, Deepak, for having me here and giving me this opportunity. Welcome, Raghu, once again, and we'll have more discussions. Thank you.
Thank you, sir, for your kind words and encouragement. And now we commence to the talk. It's an absolute honor to introduce our esteemed speaker, Dr. Raghavendran. Dr. Raghavendran is a professor of surgery in the Division of Acute Care Surgery at University of Michigan. Originally from India, he pursued his medical education at JIPMA and later moved to the United States in 1991, where he specialized in critical care. A globally recognized trauma and care expert, Sir has made significant contributions to research in longevity, VAP, trauma systems, and TBI. His work on hypoxia and inflammation in lung injuries, surfactant dysfunction, and first responder training is a resource-limited settings has been widely published. Dr. Raghavendran is also a pioneer in global surgical collaborations, leading the University of Michigan and India collaborative efforts, which foster research partnerships with premier institutes like James. He has also worked extensively in Ethiopia and Taiwan, advancing trauma care and surgical training. Today, we have the honor of learning from his expertise in grant writing, a critical skill securing funding for impactful trauma research. Without further ado, let's give a warm welcome to Dr. Krishna Raghavendran.
Thank you very much. Boy, I have so many friends here. God, I have a final list of people. There are so many who have visited me in Ann Arbor. Uh, all started by introduction to our commissioner late 2008, and we started communicating.